Hello, this is Dr. Huffstader, and I wanted to take some time today to confront an issue that has been in the news lately. And in fact, I have a patient who suffers occasionally from these transient ischemic attacks, these so-called mini strokes. And she's had, any number of them over the course of the last several years. And the other day she had another one. And she had gone a stretch of quite a bit of time without getting them, but she did get another one the other day. And obviously, it scares her to have these, and it should scare her. It's not fun, and it can be serious. But the advice that was given to her by her medical doctors was to lay off the chiropractic, presumably because they suspect that chiropractic is contributing to or causing or could be a risk factor associated with these mini strokes that she's having, and the only reason they could possibly say that is because they haven't read the literature. But there have been many attempts lately, just within the last several months, to link chiropractic care with strokes or significant so-called vertebro-basilar artery accidents or dissections, the artery that feeds the base of the brain. And as a result of this growing suspicion among allopathic and conventional healthcare practitioners, there have been a whole slew of retrospective studies done that have involved huge numbers of patients over many visits and many years of care. And what they've found is significant, and it shows that the risk associated with chiropractic manipulations of strokes is basically no different than the risk of standing in line at the grocery store or what's called spontaneous occurrence of strokes. And so what they found, a huge study that was conducted by the RAND Corporation found the incidence of stroke associated with chiropractic was 1.46 events per 1 million adjustments. Several other studies have showed anywhere from 1 per 400,000 adjustments to 0 per 5 million. But the one that seems to carry the most weight and seems to be the average and make the most sense is the one that was conducted by the RAND Corporation. It's a huge study over I think 10 or 15 years they did it, and basically they showed that it wasn't even worth talking about. It was less than 2 events per million adjustments. And to put that into perspective, I wanted to share with you some other statistics and about the events of strokes and as they relate to these other procedures. So with a cervical adjustment, an adjustment of the neck, we have an incidence of 1.46 per 1 million adjustments. There are 700 incidents of stroke following spinal surgeries. There are 13,500 incidents of strokes per 1 million appendectomies. You get 7,600 strokes per 1 million caused by medical errors, medicine prescription errors, 5,000 per 1 million caused by smoking, and 10 strokes per 1 million canoeing trips. Now, I say that sort of as a joke, but the point is that chiropractic, all the results of all these studies say that chiropractic has absolutely no bearing on whether or not you're going to have a stroke. Absolutely none. And to recommend that somebody not get adjustments because of fear of strokes is revealing ignorance about it, and it's bad advice. So if this is a question that you've had, and if this is a concern that you've had, or somebody you know, you can share with them some of these statistics. And the truth of the matter is that you have no more risk of having a stroke caused by a chiropractic adjustment than you do doing anything else. The risk is about equivalent to spontaneous occurrence of strokes. So it was a pleasure to talk to you, and I'll do this again soon. Bye.